support. How can a nurse go from caring for 4 people to 30 when we have a budget of $74 billion and our provincial government is coming in under budget? Where is the money going? So, hello everyone. Welcome back to the Wall to Wall podcast. Once again, this is Dubs.
I'm Cosmic.
And we're here to talk about another, I wouldn't say it's controversial, but definitely another interesting topic. Today we're talking about healthcare in Canada, specifically healthcare in Ontario.
Is new information tonight highlighting the state of healthcare in Ontario, and it does not look good.
The details come from a leaked report on hospital emergency rooms. And as Queen's Park reporter Siobhan Morris tells us, opposition parties are demanding answers from the Ford government.
An Ontario health document leaked to the Liberals reveals that in that month, a series of wait times
were the worst they have ever been when compared to every other August since 2008.
Data shows 9 in 10 people turning up to emergency waited up to 33 hours for an inpatient bed, an increase of 54%. By 8 a.m. every morning in August, about 884 patients were in emergency waiting for inpatient beds, up 53% from August 2021.
It forces us to move faster, to not necessarily deliver the full scope of care that we would like to under normal circumstances, potentially even to cut corners, and increases the probability that we would make mistakes. And so it's dangerous, it's indignified, and it's not right.
Yeah. So the state of things now, I guess to start, growing up, with healthcare, we have socialized healthcare here in Canada. Growing up with this system, it just seemed almost too good to be true. There was never a problem with booking a doctor's appointment, finding a specialist, getting what needed to be looked at within a reasonable amount of time. I remember the first time that I found out that I had allergies, I was able to see an allergist in a few weeks. Cut to by the time I entered university and I needed to see an allergist. Do you know how long I had to wait?
6 months.
8 months. I had to wait 8 months
I
to
had
see
to
an
wait
allergist.
6 months for a dermatologist.
Yeah. Oh, yeah. I waited 6 months for a dermatologist as well.
Yeah.
So I just what happened from childhood waiting a few weeks to adulthood waiting months?
Maybe pediatric care too is on a different time scale.
That could be, but
generally speaking, though, Ontario healthcare has kind of gone down.
Yeah, gone down in service because, to speak on allergies a little bit longer. I mean, there are some people who have, different skin conditions that arise from allergies, things that are concerning, potentially life-threatening allergies where they have to wait 6 to 8 months to find out what it is that's causing their discomfort. That seems urgent. So even for urgent care, people are waiting a long time.
And this kind of related but unrelated, I remember reading articles over the course of the last 5 to 10 years. Kids in particular with autism.
Yeah.
That since there's been so much more diagnoses, parents and families and kids end up having to wait a lot longer than they used to in the 90s and even 80s when they were diagnosing them at first. So diagnoses have gone up, obviously, but that's not to take away that our system is failing with the services that we're supposed to be providing the people.
It's failing drastically. So, I mean, you hear these stories, okay? We'll bring it to even more present time. We have healthcare during a pandemic and then healthcare after the pandemic. It seems like the decline is even more noticeable now, where you have, for example, there are families, there are children dying while waiting for paramedics. This is unacceptable.
Yeah. That is unacceptable. So we talk about the free healthcare system.
Yeah.
This is a public healthcare system funded by Canadian taxpayers.
Yes.
And provincially, so provinces are incentivized to get that federal funding. They're not obligated, but obviously they're incentivized. So the
Yeah.
federal government brings the taxes into the system, but we have no control over, as a people, we have no control over how this money gets distributed.
No, we don't.
So we saw huge holes get exposed during COVID, long-term care,
Yes.
merge emergency services.
Yeah.
That includes ambulances
Yeah.
and a lot of frontline workers, nurses, orderlies, people on the front lines, just constantly going stressed out and vulnerable.
Overworked, burnt out, people quitting, leaving their careers because there just wasn't enough support.
High turnover, and now there's shortages everywhere.
Drastic shortages. Case in Ottawa, at a children's hospital, they had to bring in the Red Cross
They
in
did.
order to deal with all the children suffering from the flu, COVID, and RSV. That's ridiculous.
Yeah.
This wouldn't have happened 15 years ago.
Is it also because of population growth, or is it just because of mismanagement of services?
I think mismanagement. Because if you have population growth, then that's more people paying more taxes. Therefore, they should be hiring more doctors, more nurses to support the additional people. So, additional people, because we're paying for it,
Yeah.
they should be helping to fund the growth of a publicly funded health system. That's not happening. Okay, here in Ontario, okay, the budget that the provincial government set, I think this is for either 2022 or 2021, they set a budget of like 74 billion. We have roughly 14 million people here in Ontario, so that works out to about $5,000 annually per person. Right now, the provincial government, that's what they budgeted. They're coming in under budget. How are they coming in under budget when there are people waiting hours for an ambulance? There are nurses who years ago would work one nurse to 4 people who are now working one nurse to 30 people?
That's just ridiculous. Somebody is going to lose their license, and it's going to take that.
Yeah.
That the nurse gets blamed for negligence, or the doctor gets blamed for negligence. Well, where's the support?
There's no support. How can a nurse go from caring for 4 people to 30? When we have a budget of $74 billion and our provincial government is coming in under budget, where is the money going? Now, we know that heads of hospitals and certain types of doctors are getting paid billions of dollars.
Sunshine List. Hello.
Yeah. So obviously part of the budget,
The muddy
part of
budget.
yeah, exactly. The little Freudian slip that actually worked out quite well. Muddy budget, yeah. But yeah, so part of the budget is going towards funding this administration, these doctors, but we're still under budget?
Mm.
Where
Somebody's cutting corners, and somebody's cutting some fat checks for a few people.
exactly.
Now,
Exactly.
there's no oversight, there's no counsel or accountability for people at the top. Now, it's one thing to go after the rich to, make them pay more in taxes, but
Yeah.
this is affecting lives
Yeah.
of real people. You can see clearly the correlation. Someone gets paid because they're running a hospital $800,000.
Right.
Meanwhile, patients aren't getting treated.
They're waiting 6 hours, 8 hours, 10 hours in emergency rooms.
Now, the implication is that they're waiting for a bed.
Yeah.
There's no beds. Hospitals make money when they're filling beds.
Yeah.
So they want their beds full. However, now certain cities in Ontario have closed hospitals.
Why are they closing hospitals?
How does that work?
Where are the people going? I mean, if people have to wait 10 hours at one hospital when they're in a certain area where there used to be 3 hospitals, but now they've closed 2, how does that even work?
So you would think logically hospitals are closing because they're not filling beds.
Yeah,
However, we're
not
in
enough
this
funding.
situation where
There's enough people.
there's not enough beds anymore, but we've closed hospitals. Like that doesn't why aren't we making hospitals?
There's something fishy going on. There's a lot of questions that need to be answered, and I think our government needs to be held accountable.
Yeah.
What are they doing with this budget? We're closing hospitals, so that should be saving even more money. We're coming in under budget, but we don't have enough nurses, we don't have enough ambulances, we don't have enough beds.
Yeah, that ties into the education system too. We see universities becoming inflated with administration fees and
Yeah.
tuition keeps rising. It's this similar kind of situation. And are people getting a quality education? Are nurses and health practitioners being trained with quality education to become ready for crisis in hospitals? Like we don't even see that happening on the school side of things either. So
No.
and that's big money. Where's all this big money going? It's so frustrating.
Somebody's happy, and it's not the everyday Jill and Joe. So I guess the question is, where do we go? I mean, do we do we protest? Do we knock on the doors, so to speak, of our MPPs? Do we say, hey, we need better health care? Do we make them change? Do we vote for another party? Do we vote in NDP instead of our current conservative government? Do we do that? Or do we go completely in the other direction? Get rid of social health care? Do we do a hybrid system and start making it more privatized? Like, what's the solution?
Well, the thing
How do we
with,
make this better?
with privatized healthcare is you see issues with the Americans
Yeah.
south of the border. They end up having to pay so much money for just regular operations, regular healthcare.
Yeah.
And then when you're in a privatized system, if you have the lowest grade Medicare,
Yeah.
you're going to the cheap hospitals and you're receiving the cheapest care.
Yeah.
And if you've got the money, then you get to see the good doctors.
Yeah.
So that's a gradient system. That's got its own pros and cons.
It definitely has a lot of cons and flaws because there are people not getting equal care. People get left behind. There are people suffering. You have cancer patients who don't get the same type of treatment. They're getting end of life care rather than, preservation of life care. There are definitely there's definitely huge flaws in that type of system. But you know, what is the Canadian healthcare system becoming?
It's a little scary. I think I read something today. Even pre-COVID, we've seen a trend because our population in Canada is aging.
Yeah.
So there's going to be more old people than young people.
Yeah.
And that emphasizes a need for a robust long-term care, home care types of services
Yeah.
that we see aren't the most supported, at least in Ontario.
No.
That's a whole system that we kind of have to really reinforce for our aging population. Then it got me thinking, okay, so old people cost a lot of money to take care of, especially the longer they live. That's why MAID is so popular now.
Easy solution. Yeah, bring it back to our previous podcast. Is that a solution to an ongoing, growing crisis here in Canada? Is that another facet of the whole MAID controversy? Possibly.
Let's cut more corners, let's just
Yeah.
cut lives out.
It's certainly a lot cheaper to fund end of life than end of life care takes a lot less time. What did we say? It takes like 90 or so days for an application to be approved. And then bye, rather than, the next 20, 30 years in a long-term care facility for those lucky senior folks in our communities.
But it seems counterproductive too when you think about a healthcare system based off of filling beds.
Yeah.
Because we're just going to kill off all the old people over the next 50 years. Like, who's going to keep the hospitals full if all we have are healthy young people?
They're just going to close more, and then our provincial
Oh.
government can save more money.
Oh, nice.
They have their nice heavy budget, and then instead of spending like 85% of the budget, soon it'll be 75%, and then 65%, and down. The budget gets lower, and they'll be like, "Look, we're saving you money," but for some reason, our taxes don't seem to be decreasing. There's definitely a darkness to what's going on right now. I'll give a personal anecdote. The other day, a member of my family was waiting for an ambulance. We waited almost 3 hours
For an ambulance.
for an ambulance. Yeah, for an ambulance.
Jesus Christ.
Ridiculous. Then this is I guess not an emergency, but definitely urgent, requiring urgent care. Had to wait another 3 hours. I guess that was a short wait that day, but another 3 hours to even get a bed.
Ah.
Okay, to get a bed. Once getting a bed, they're like, we need more beds. They're closing hospitals, and then so they're putting more beds in hospitals. I think my family member was in, it looked like an old storage closet. I mean,
Makeshift rooms.
makeshift rooms. Yeah.
Yeah.
I mean, it's crazy. And then there's just not enough nurses in there. You have, like I said earlier, one nurse trying to serve multiple patients, up to 30, not all the time, but it could be up to 30 depending on the day.
Especially the merge nurses, I think.
Yes, emergency nurses. Yes.
Yeah.
They're overrun. So it's not surprising that you see nurses getting burnt out,
Quitting.
retiring in their 30s. I mean,
Yeah. Or contracting themselves to be like external of the hospital.
yeah, working elsewhere. So, but like, you have people retiring in their 30s after they spent like 5-6 years in schooling, spent thousands of dollars
Investing in their career.
investing in their careers, and they leave that behind because what we have going on here is not sustainable. Then there's the other side where I guess there are 3 different types of scenarios we have going on here. Then you have other nurses who are like, okay, well, I spent thousands of dollars on my career. I am not being supported here. I am moving.
Yeah.
They're leaving the country, period.
Yeah.
They're making more money. They're being more supported down south.
Yeah.
They're gone. And then you have the people who stick around, okay, that are overworked, working double shifts. I'll say it again. How can it go from one nurse taking care of 4 patients to taking care of 30?
Yeah.
That
'Cause
is
they're-
crazy.
They're grossly understaffed. I have a few family members, they're nurses, and getting their firsthand experience. So the hospitals want overflow. They
Yeah.
want beds filled, and they want them at capacity because every bed filled is money.
Yeah.
So a lot of scenarios are created where they send patients up to a floor,
Yeah.
but they don't have a room.
Yeah.
So they're what the nurses call the hallway patients. And you don't have access to all the same amenities that you have in a room. You have a makeshift IV if
Yeah.
you're on fluids, and you're in the
walking around
hallway.
in
You
the
have
hallway,
no
patients.
privacy.
Patients walking
Yeah.
around in the hallway. They don't have a room with their fluids.
Yeah.
Yeah.
So that's just the state of it. And that's apparently what hospitals want. Whoever is in charge of making these decisions, like we need accountability, and we need to make sure there's transparency with how we're distributing resources.
Yeah.
It's just not making sense. Like they're short on nurses and other healthcare frontline workers, and they're short on supplies.
They're not paying the nurses enough to deal with the crap they have to deal with.
Yeah.
It doesn't make sense that the nurses aren't being supported physically, emotionally, financially, and then you have these hospital CEOs, administrators, even, some doctors getting paid hundreds of thousands of dollars, and they're benefiting from our social health care as well. So, I mean, there seems to be some kind of imbalance there.
For a socialized system,
Yeah.
there's definitely a hierarchy, and not that hierarchies are bad per
No.
se. It's just we need to check ourselves.
Yeah.
Otherwise, when we're old
Yeah.
and gray and we need these services, we're going to be in trouble.
In a perfect world, I want it to be like how it was when I was a child. A healthcare system that seemed to work, where you didn't have to wait to see a doctor. But it's gotten so terrible now that, I would pay. I would pay extra on top of my taxes just to be able to see a doctor.
To
Just,
receive the benefits.
yeah, to receive the benefits, just to be able to receive better care. And I don't think it should be that way.
No, not when our taxes are going up every year.
Yeah, no.
Like it's just we should be a democratic society. We should have a say in how our money is spent. And that's the problem, I guess, is
Yeah, that is a really big problem with the way it should work. We should have a say with our vote. But the thing is, we have politicians that make these promises, okay? And then we hear them, we're like, okay, you're going to do this for us. You're going to do this. We check the ballot and then nothing happens.
something's got to give.
Something's got to give. I guess right now we don't know what the solution is. Do we work on correcting our current social health care? Do we navigate some kind of hybrid, or do we tear it all down, start over, and just build anew, completely private? I don't know. So,
We leave you with more questions than answers.
as usual, more questions than answers. But one thing that I do know, that is, if you like what you're hearing, then you should like, comment, share, and subscribe down below. So once again, this is the Wall to Wall podcast, and we are
Signing off.